Thank you, Rachel. Hello, everyone. I am going to build off of Rachel's comments and remarks to talk also about quality and continuous improvement and how we use data and data measurement in an applied way in practice to help inform and improve our service deliveries and our system in the juvenile justice system. So my remarks are going to be very conceptual in terms of conceptual potential here. I'm not going to go into a lot of the technical details. Because there are two different tools I want to introduce, and there are a couple of slides in here that I'm going to skip over. They're context for you for after the meeting if you have an interest in knowing some of the just infrastructure for the project. But the project is Juvenile Justice Reform and Reinvestment Initiative. It's a practical, comprehensive approach to reforming juvenile justice. It's taking data and using it in the service delivery system, both in terms of community-based services and in the system side, and working with the courts, the Juvenile Justice Agency, to improve policy and contracting and how we fund services. With obviously the ultimate goal of improving outcomes and cost effectiveness. So what we know from the research in juvenile justice is that early intervention is less expensive and more effective. I think we all generally know this across the social sciences. But for juvenile justice, we have definitely documented in the research that a deeper a youth goes into the system, the more likely they are to reoffend. We know that control mechanisms don't work as well as therapeutic approaches. So how do we balance that in a juvenile justice system where the general public is worried about safety and cost, and we're working to improve outcomes and reduce recidivism? So this entire initiative is organized around the primary outcome of recidivism. These are some of the contextual slides I'm going to skip over, but this is a project funded by the Office of Management and Budget through their Partnership Fund for Program Integrity, and this project is one of the innovation pilots. These are our partners, and I would be remiss in not mentioning Georgetown University and Vanderbilt University. Similar to Rachel, they're working with us on implementing these tools, and then we have the Urban Institute that's evaluating our progress. So our goals, and I'm going to talk about what SPEP is in just a minute, but our goals are to improve program delivery, which is the SPEP scores. We're working to improve the match between the youth risk level to their supervision level and the youth's needs to the service that they're receiving, to make sure that that match is properly aligned. We're certainly finding from the data that kids are not necessarily sent to the right places and getting the right type of services. And then ultimately that will improve the reinvestment on the front end, that we move that cost savings to the front end of the system to build more community-based services so that we're serving youth in the community and not in confinement. Okay, so I don't know if I can point to the, so the primary pillars for the juvenile justice reform effort is to increase the match between the risk assessment and the supervision levels, and we have tools here. We have lots of risk assessment tools that are valid and reliable, and of course we have found similar things in terms of that it's not a static process, that's something that agencies have to continuously work on. Then we have the connection between supervision and needs, and a lot of this in the juvenile justice system is sometimes driven by the courts and judges making those decisions with the advice of juvenile justice agencies, but a lot of that is driven not by the agency overseeing the youth. And then lastly, the match between the youth's needs and the program. So I referenced SPEP, which I'll talk about next. That happens here, and then I'm going to talk about another tool that we use, which is related to sentencing guidelines for the courts, or dispositions, dispositional matrix tool that we're using here that's a data-driven process. Okay, so I talked about this is just the steps in our implementation. The program rating instrument that I am referencing is the Standardized Program Evaluation Protocol. It was designed by Dr. Mark Lipsey at Vanderbilt, People lovingly refer to it as SPEP. They've even turned it into a verb. So programs do SPEPing, and they've SPEP'd, and yeah. So, but it's great. It shows engagement with data, which is exciting. So the programs our pilot sites that we're working with, they do the SPEP, they rate their programs, and then they come up with their first set of scores. That guides them in a program improvement process. Then they SPEP again, and we're hoping to see the change over time in terms of that program quality. So the genesis behind SPEP is based on a meta-analysis that Dr. Mark Lipsey did of over 600 evidence-based programs that demonstrated effective reduction in recidivism as our primary goal. A lot of secondary goals were also achieved, but the only programs that he filtered out programs focusing specifically on recidivism. He took that data and he started to look at what was similar and what are the commonalities across those programs in terms of quality of the program, the level of staff contact, whether it was face-to-face, the duration, intensity, things like that. And then he devised a scoring sheet. The intention here is really not everybody can implement it purely, bring a model developer out on site, invest in a evidence-based program. Those are really important. We need that research to support. This is designed to complement that process and to help lift up homegrown programs in every jurisdiction to be using similar program quality indicators. And then we'll evaluate to test the cost effectiveness and recidivism and that movement on the SPEP scores that I mentioned. Just for reference, we're in the third year, and this is not as linear of a process as it looks. Okay, so I talked about this already a little bit in terms of the SPEP. These are the 4 key areas that are covered. And so I just want to qualify, it says program or service type, but it's important to understand that as in the service delivery system, we package a lot of things together. This tool narrows it down to the specific service. So, and the only things that are included and categorized by service are things that there is a robust research base around. So, for example, case management is not an area that has been narrowed down to a specific service per se, and the literature that's out there on case management isn't robust enough to indicate a specific direction in terms of quality improvement. So that's an area that's difficult to rate under the SPEP tool. But you can take mentoring, for example, where there's a lot of robust literature and clear indicators around levels of service, contact, and duration, and those services are categorized. So it is an evolving process, and if Mark were here, he would say it is a process, not a tool, but it's sort of a little of both. So I talked about this, about how that then once you get the SPEP score, then the program looks at that score, they see where their contact hours may be low, they work with the agency to change the contracting procedures to lift up the amount of service contact that they can have for that youth, all with the documented goal and assurance that that's going to move them closer to a positive outcome of reducing recidivism. So that change process takes place, and then we rescore. So I'm going to, for interest of time, skip over this a little bit so I have time to talk about the dispositional matrix, but I just want to express sort of the holistic process that's going on here. You've got SPEP rating and scoring on one end of the system, and then you have system alignment that's happening all over the top in terms of you've got to know what programs you have in your community, make sure that you have the right kinds of services, so that when you're assessing the risk level of a youth and you're assessing the program quality of youth, that you have some place for that youth to go that fits. So there is this alignment process and why it takes time, and it is a continuous improvement process for all of the partners involved, the courts, the agencies, the providers, and the youth themselves. So the dispositional matrix, This is really a structured decision-making tool. The intention is really to help through a collaborative process with the agency and the courts and those making decisions on behalf of youth in the juvenile justice system, that they're making decisions in a consistent way and that they're adhering to what our research tells us about recidivism rates and matching risk levels for the youth. So I just want to show it to you in black and white. We have the different levels. This comes out of Florida. They have a statewide system that allows them to capture the data on this, and this data comes from 2013, and it's really kind of exciting. So you will see in each of the boxes, I think this side is the type of offense, and this side up here is the type of risk level. There's different risk tools. They have different, some have 4, some have 3. As long as it's reliable and valid, each jurisdiction can tailor this to their own system. But what this guides folks statewide in Florida is where they should place youth based on their risk level and their offense. So you will see in the box that there's some range, but there is an underlying principle that the guidelines state that the goal is to put youth in optimal placement. Optimal placement means least restrictive environment, with the priority being meeting the youth's needs. So in every case possible, they need to meet the youth's needs in the community. So you will see even for violent offenses that are high risk, that secure confinement is only one of the options. And that's supported by research that a lot of recidivism for youth, they just age out of developmentally. In terms of developmental approach, it's really about meeting the needs in the most effective and most cost-effective way. Okay, so this just, I don't expect you to be able to read this, but what you'll see along the top here is this is optimal placement, appropriate placement, and above guidelines. So this shows that annually that Florida was able to track with their data where the sentences for these youth were, how they fit into the guidelines. So they know in every judicial court in Florida whether the judge placed the youth above the guideline, below the guideline, or optimally, meaning within that box but least restrictive environment, high priority on meeting need. And this is what they found, that when youth were sentenced below the guidelines, meaning their risk levels were higher and they still got sent back to the community, but they didn't get services or support, recidivism jumped up to 53%. When they were placed optimally, recidivism went down to 18.9. Appropriate means least restrictive, but not necessarily least restrictive, but that they're meeting the needs of the youth. And so those two are somewhat similar, but it's about the level of confinement or the level of supervision that a youth has was 21% for appropriate. And then you'll see that when they were placed above the guidelines, it jumped back up to 34%. It's really powerful data. And what's also really powerful is that they know across the state how people are using the matrix from a discretionary standpoint. So it's okay. I mean, it's not intended, the matrix is not intended to take away judicial discretion. Cases need to be decided based on the individual needs of that case. But if a jurisdiction or a district is making discretionary decisions always above the guidelines or always below the guidelines, this gives them the data to show them the direct impact of that. And the state knows. All right, so I'm bringing you back to this chart just to remind you about the pillars. So we have SPEP over here, we have risk levels here, and then sort of in between here is that dispositional tool. Altogether, we have a system-wide reform process designed to bring up quality, increase the quality and delivery of services across all the programs in a community, and to get better match of placement and supervision for the youth. And, oh, whoops, I didn't mean to do that. So it's very exciting work. We're in our last year, and I think that there's a lot of potential here. We're evaluating it. We'll see where it goes. It's based on decades of research on recidivism for juvenile justice, and we think it's one of the next best things in terms of helping us meet our mission, which is to have the juvenile justice system be rare, fair, and beneficial. So thank you.